We are going to go live now to Governor Rick Perry, who is holding a press conference in Dallas on this latest Ebola case.
I've been in very close contact with the director of the CDC, Dr. Tom Frieden, as well as all the appropriate Texas state health officials. We're working very closely with the local, both the city and the county health officials as well in this very serious case as we partner. As you know, a patient was admitted to this hospital on September the 28th, subsequently tested positive for Ebola. Today we learned that some school-aged children have been identified as having had contact with the patient and are now being monitored at home for any signs of the disease. I know that parents are being extremely concerned about that development, but let me assure these children have been identified and they are being monitored, and the disease cannot be transmitted before having any symptoms. I have full confidence in the medical professionals, in Superintendent Miles, in our local, our state, and our federal partners in keeping this contained. This is a disease that is not airborne and is substantially more difficult to contract than the common cold. We have experts here with us today who will be talking to you in a minute about the precautions that you may want to take. The medical community of North Texas, along with officials from the state and federal government, have been working together to take every step available and necessary to care for this patient's health and to ensure the safety and welfare of our citizens. There are few places in the world better equipped to meet the challenge that is posed in this case. Texas is one of only 13 states certified by the CDC to conduct diagnostic Ebola testing. And we have the healthcare professionals and the institutions that are second to none. The public should have every confidence that the highly trained professionals involved here will succeed in this very important mission. Public health investigators from Dallas County and from the Texas Department of State Health Services are working to identify, to locate, and monitor the health of all of those who have come into close contact with the patient. The highly qualified men and women of Texas Health Presbyterian are doing everything in their power to deliver the very best care for this patient. They have been and they will continue to be in close contact with federal, state, and local officials to ensure the public safety. This case is serious. Rest assured that our system is working as it should. Professionals on every level of the chain of command know what to do to minimize this potential risk to the people of Texas and of this country for that matter. I'd like to ask Dr. David Lakey, he is the head of our state health services, to come and share with you the efforts that are ongoing as we address this issue. David?
Yes, sir. Well, good morning, everyone. My name is David Lakey. I'm the commissioner of the Texas.
We've just been listening to Governor Rick Perry speaking outside of the Texas Health Presbyterian Hospital, where the latest case of Ebola has been confirmed here in Texas, the first diagnosed in the U.S. But Governor Rick Perry reassuring the public of their safety and health and of the abilities of the Texas Health Services to treat this latest case. We'll have the very latest on Governor Rick Perry's comments in our newscast at 5 and 6 o'clock tonight.